Home active care for the hand, wrist, and forearm.
Hello. So I'm going to be showing you some different ways to strengthen the hand today. These are a few tools that we've bought from Thera-Band. Let's start with the most basic. Whenever somebody has a carpal tunnel problem, you want to encourage them to do splaying of the fingers. On this left hand here, I can just use a regular rubber band and do splaying of the fingers. On this right hand, you can see how I just carefully twisted each little piece to cause little loops. Make sure you don't twist it several times so that you end up strangling any of the fingers. The movement of going from this curled position, which we tend to be in when we're using when we're typing and using the keyboards and such, the opposite of that is to do an extension and abduction of the fingers. This movement pattern is the beginning part of Brugger's position, which starts like this, and then we bring their arm all the way out. And I'll show the whole thing later when I show the shoulder section. So rubber bands, some experts say 10 of these a day keeps the carpal tunnel syndrome away. The next thing is, how can we strengthen the forearm so that the arm itself is strong enough to handle the lifting and the actions of the day. Basic movement with an easy Thera-Band, or as you progress higher in resistance, is quite easy. I like Thera-tubing as well. Thera-Band's very versatile, so is Thera-tubing. Thera-tubing appears to be a little bit more resilient. It doesn't tend to get the cracks. Always inspect the band before doing any activities, just to make sure that there's no tears in it and it doesn't snap and hurt the patient. So in this case, I can just put down the band and just do some basic flexion, basic extension. Now it would be better if I had my arm down on something, so I'm placing my arm down on a fake table. And you can see the eccentric jiggle that I have right there. So even this double yellow is a little hard for my eccentric control with my extensors. Then I could do ulnar deviation and radial deviation. And then there's always the corkscrews. I call this the corkscrew motion, corkscrew, and then reverse corkscrew. So I'm not in the way. Reverse corkscrew and corkscrew, although it doesn't make sense on this side because the right hand is the corkscrew that way. So again, pulling, moving all the different directions. This is a very cool tool. A lot of people will use this particular technique to strengthen the flexion and extension. They'll use something like a broom and tie a string to it. I'm using a Thera-Band today, and then tie a weight to that Thera-Band. And then what you're going to do is slowly roll up so that that weight will come up into the air, and it lifts all the way up, and then it goes all the way down. I like using tools that they have in their kitchen. So this is just a regular broom. This is another band right here, or this is another tool that I could use. These people love these. You can iron out the trigger points. They can do it to themselves. It comes with a little instruction manual. This is called the Roller Massager by Thera-Band. There are two types. I like this kind better. The compact one, the handles don't seem as strong. I like this one. Other people get tiger tail and other self-massaging or massaging tools. This one is pretty inexpensive and very durable, but it could also play a role. I could tie a knot around this roll here, tie the weight down here, and I could roll this whole thing up and bring it all the way down. And you can see how that rolling motion is really moving the tendons and the muscles in a healthy manner. Another thing a lot of people need to work on is grip strength, especially after any hand injury where they may have had some atrophy. So this is a Thera-ball. I'm not sure what these guys are called, squishy balls I call them, but I could use something like a toy, something you get down at the store for the dog. Or I could use even something like a tennis ball, but tennis ball you can see how much more resistance there is. What's nice about this is good for practicing grip strength, but again, we do most our action in a grip position. I'm thinking we need to do more splaying, so you could actually push on the ball like this. And I don't have any here today, but Thera-putty is a pretty great thing to use for the splaying. This is another little tool. This is the Hand Xtrainer. So pretend this is a puddle of Thera-putty, and I can actually just splay out right on the table. Or I can buy this Xtrainer, which is, it's powdery because you put cornstarch on it and stuff like that so it doesn't get sticky as it's sitting in its container. You can see how cool that works. You can increase the tension by putting it closer. Comes in different variable strengths. Red's pretty easy. I would suggest people starting with a blue or higher for most strong arms, because you can see this one gives me some strength. This one gives me some resistance. So the other thing I like about this Xtrainer is either I can have the squishy ball, or after I've done my Xtrainer work, I can just crumple it up and then it becomes squishy ball. Now, you know, if people were baking bread, they'd probably be able to get their muscles strong, but you can see how the muscles fire as I squish this. And you can see if I turn in different positions, I'm strengthening and turning more muscles at different times. Now, a lot of the shoulder and wrist pain will often come referred from the shoulder. I'm sorry, a lot of the elbow and wrist pain will come from the shoulder. So I have to think, is it a subscapularis, an internal rotator trigger point that often goes to the wrist? Is it an external rotator, any of the other rotator cuffs, supraspinatus, infraspinatus, teres minor? Is it one of those muscles? Because they refer as well to the elbow and forearm. So always be thinking what proximal thing is causing this distal problem with the referral pattern. So these are the big things that you can do with the Thera-Band. One other thing I like to say, I tell people, pretend you're just cooking. So you've got your dough, and you're first going to be kneading it. So do you see the action of my hands right there? I'm just kneading it, and then I'm going to knead it backwards, or roll and roll back. I love the Karate Kid movie, but I say wax on and wax off. So you tell them to use something slick, like a towel on the slick surface, and tell them to significantly think about parking the wrist and moving, and parking the wrist and moving, and then maybe doing full circles so they're using more of their shoulder. It's the wax on, wax off. The Broom Handle Rolling was the one that I showed you right here, back and forth. The splaying with the rubber bands, absolutely important. Again, if everyone started baking bread, we'd probably do better. But you can actually go like this with the bread dough on the cutting board. So lots of things you can do. I would say you got to always think about what's hurting. Don't overuse the thing that's sort of sore. Make sure you're doing some trigger point work with some ART work perhaps. You know, there's all sorts of different ways you can do this, or MRT. And one last thing. Grip strength, the whole hand, is different from finger strength. So I call this two different ways. This is called the alligator or crocodile mouth. This is called the bite mouth. And watch what happens. Crocodile mouth versus bite mouth, pinch. Crocodile mouth versus pinch. Now watch how weak these two fingers are for me. Crocodile mouth, giving me a nice cramp down here, and pinch, giving me a nice cramp right there. Crocodile mouth, pretty wimpy, I'm not a piano player, and bite mouth. So, and then of course there's those people who are amazing, and they can roll the balls between their fingers. That's not one of me. I wish I were. Perhaps taking up drumming would be good for the arms. There's so many inventive things. Anyway, thanks for stopping by for this video.